Advanced degenerative disc disease that results in spondylolisthesis is a condition where the disc degenerates, resulting in a loss of disc height, causing instability, and one vertebra to slip forward over another one below it. Other causes of spondylolisthesis include stress fractures or congenital abnormalities, and in rare cases, a tumor or trauma. Degenerative spondylolisthesis is a consequence of the aging process, in which the bones, joints, and ligaments in the spine grow weakened and become less able to maintain the alignment of the spinal column. This type of spondylolisthesis typically occurs at one of two levels in the lumbar spine, L3, L4, or L4, L5, which is the most common. Degenerative spondylolisthesis is more common in people over age 50, and in particular among individuals over age 65. Women are 2 to 3 times as likely as men to be diagnosed. Spondylolisthesis can cause impingement of the nerves and/or fatigue of the back muscles, and may result in lower back and/or leg pain. Symptoms of spondylolisthesis may include lower back and/or leg pain, sciatica, an aching pain in the hips, buttocks, and lower back that radiates into the back of the thighs and legs, a shuffling gait when walking, weakness in the lower extremities, abnormal posture. If you feel that you are experiencing any of these symptoms, you should see a physician for an accurate diagnosis.